show. And the brand news about today is that Amaya and Anupama are doing a show after a long time.
That's very true. Good morning, Anupama.
Hi, good morning.
To see you again after a very, very long time.
I know. And I know that we are going through something very similar these days.
Yes.
If I'm not mistaken.
Very true. It's something to do with exams, isn't it?
Academia. Basically, Amaya is writing and I'm marking.
Put it in a nutshell. Both of us have been through quite an ordeal, and I don't want to discuss it on this brand new morning.
I know. And I'm done with marking as well. 600 papers to be exact. But that's cool. I'm used to it right now. Anyway, so without further ado, we have a very interesting guest on our show today to talk about a very a topic that lots of people are discussing these days. Maybe people of our generation, young adults in Sri Lanka. They have issues with regard to this particular topic that we are going to talk about. And also, in certain aspects to educate us and to make us a little bit more aware of what's going on around Sri Lanka regarding fertility and getting pregnant the right way. Today we have on our show a very, very special and privileged guest, Dr. Rohana Hatthotuwa. We are very, very privileged to have you here. Sir, Dr. Rohana Hatthotuwa is an expert in the medical field, a very renowned gynecologist, and he also is, we are thrilled to know that he also was a former lecturer in the University of Colombo. Welcome on the show, sir.
Thank you.
I think in many capacities you have really addressed this issue of fertility as well as conception here in Sri Lanka, and it's again something that every family will go through when it starts out at the beginning, but the amount of information that people have at hand when it comes, especially in Sri Lanka, to this, the birth of a new life is very limited, and that's a sad situation. So it's great to have you on the show with us, Doctor, this morning. But if you can tell us exactly how does infertility occur? How do you say that someone is infertile?
Yes, that is a good thing to discuss, because this is becoming ever increasing problem in Sri Lanka also. It is just that it is not a painful thing until because it's not a physically painful thing. Right. Only it becomes painful when it gets into the mind, and then it becomes a very difficult thing to cure. So this infertility or subfertility, it's what I tell all my patients is like passing an exam, because until we think that we see all the others passing the O-levels and the A-levels, and we think it is a very easy exam to pass. But once we go to sit the exam, only we realize how difficult it is, and till we get through it, we don't know whether we will ever be able to pass.
I think what's interesting about Amaya's question is that in Sri Lanka, I think there's this whole new understanding about infertility when it comes to, the cultural wise definition of it and the medical wise definition of it. So it's very interesting to sort of, set borders and set boundaries as to where the correct scientific definition lies.
Yeah, the scientific, we can't go by the definition itself, because it differs from person to person.
Because maybe organization or WHO would have a different definition.
The problem, the real definition is if a couple have been trying for a pregnancy for more than 1 year, and if they have failed to conceive within that period, then we consider them as subfertile. We don't call them infertile, but subfertile, but if someone is over 40 years, we can't wait for 1 year.
Of course.
Yeah, because then there is hardly any time left to conceive. So even after 6 months, we should try to see whether there is any problem and try to sort it out.
According to the facts that I have, Dr. Hatthotuwa, it says that the general infertility rate of Sri Lanka is 10%. And that's, like we were discussing before the show started, that's a pretty high rate. What do you think the reasons are for this?
Yeah, actually there are quite a few reasons for it, and sometimes we can't find a reason also. That is another thing which we have to understand. There are because there's a limit to what we can also find out medically, but as you know, this 10% is also gradually increasing in this country also, because of so many reasons, like delaying the marriage. Now the
age of people are going for education,
and
higher qualifications.
Higher qualification, and then to get stabilized in life and see that they have all the things before they start marrying, and then also after marrying also they may postpone having a baby. So by all these things, the age is increasing. So usually the best age to have a baby is from 19 to 23 years.
Oh wow.
I think hardly anyone has.
Oh dear. I feel really old right now.
I think in Sri Lanka, I mean, there is the cultural aspect.
That's so true.
A majority of the population might actually be starting family life, especially for a girl at that age.
Yes.
But like you mentioned, that percentage is slowly decreasing and becoming a very small slice of the pie. So, what's the age where after that age it becomes really difficult to conceive?
Now after that age the success rates now between 19 to 23 years you may have in 1 month. Now we think that sometimes you try for a pregnancy, that same month you will conceive. No, that won't happen.
Right.
Even if everything is happening correctly, even the chances of conceiving in 1 month is only 20%. So in a young person, but as you grow older, so if you come to 40 years, the chance of success will become 5% a month. And at 45 years it will be 1%. So
and is this just the female or is it the male as well?
Oh yeah, the male is also.
Because I think most people are the impression that only the female and the wife has the biological clock ticking, but that's not the case, is it?
No, the thing is, this was the I think we have those days what people thought, and the whole blame was on the female. But now it has turned around, and I think more than 50% in couples, the reason for infertility or subfertility lies in the male, because of this the problems in the sperm counts.
I see.
Now the sperm quality and the sperm number is gradually reducing, and we find so many people with poor sperm counts.
Is it something to do with lifestyle or the urbanization of everything?
So all these things, the environmental factors, the air pollution, the stress of work, stress in the
even stress.
Stress is
stress is sort of a general cause.
I think it's a root cause for every disease that we can find, like every disease on earth. Before we started the show, we were having a small discussion. We were talking about how mentality affects conception, how a proper balanced mentality is supposed to be there in the couple, both the male and the female, in order to have a proper conception. Doctor, why don't you elaborate on that?
Yes, actually that is one thing which we don't think about so much. So always people go to medical treatment and try to get a tablet or something, and then you expect a pregnancy. But that won't happen, because psychologically you must be psychologically very clear in your mind. What I tell my patients is that even if you want to make a cup of tea, you must be very, very clear in your mind. If you are confused and if you have so many
milk powder is on boiling water all over your
I see that you have experience on that.
Definitely. Morning tea is not my cup of tea, actually. Okay, join the club.
So because it's a very complicated thing, so everything is controlled from the brain. Brain. So if the mind is not very clear and it is not if it is confused, then all the other things also may not fall into place. And therefore, even if we do everything correctly, still there may be difficulties in conceiving. So that is why we have to understand this problem of infertility very clearly, so that you have a proper plan, so that you don't get disturbed. Otherwise what happens is, there are so many people around us, especially in these Asian countries, the family, the friends, the relations, and the neighbors, everyone is concerned about
neighbors. Very true.
That's also true.
Concerned about you having a baby.
That's true.
And then you get unnecessary pressure. And this, as I told you, you can't have babies just like that.
Even and that pressure turns into stress, and the stress gets into your physical realm.
That's right.
That's what happens.
So when is the best time for a couple to start planning, how are we going to go about this, and start to plan to conceive and to start the parenting role? When should they start thinking about it and planning for it?
Yes, I mean, at the time of marriage or before marriage, when they are talking about, so I mean, the plan should be there from the very beginning.
But when it comes to conceiving, let's say they want to conceive a child when they are 28 or 29, then is it important to go through certain tests or anything like that?
No, actually, what I would of course advise is, as a medical person, not to delay a pregnancy.
Okay.
I mean, if you get married at 22 years and you don't wait till 28 years to start a pregnancy, because by 28 years we don't know what could happen to us, right? Because
it's uncertain.
Uncertain. So many things which are not there in us at this particular moment may come about as we grow older. So there are
Dr. Hatthotuwa, on that note, we have to go to a very short commercial break, and we'll quickly be back and talk about this interesting topic further. Welcome back to Good Morning Sri Lanka. We are still with Dr. Rohana Hatthotuwa, and we were talking about not delaying the plans for pregnancy. Why don't you elaborate on that?
Yes. And there are other reasons. You said now age is one of the reasons for infertility. We discussed it in the first segment. But what are the other reasons?
Yes.
And what are the types of infertility, doctor?
Yes, actually, there are, of course, if you talk about scientifically, there is what is called primary and secondary. Primary means you never conceive, you have never conceived. Secondary means you have conceived once, and then subsequently there is a problem in conceiving again. So that is second. So if you take the primary one, one of the commonest thing, of course, as I said, the age is one of the things, and there are certain problems also. Even if you are married, but still, if the husband and wife or both cannot meet each other together, and they are unable to be together quite often. Sometimes the husband is here, husband is working far away, and the wife is in Colombo, so like that. So they meet only during weekends or sometimes once a month. So then they say, we are married for 2 years, but still they have not conceived. But how can you conceive? Because they two are living in separate places. So that is another thing where they are unable to meet each other very often. So
but that causes infertility?
Oh yes, because the chances of conceiving is poor.
Reducing.
Because
there is sort of a cycle, isn't there? So there's a time when you're supposed to be ovulating, and then and other times as well. So it's important. How can someone track that actually?
Whether the time of ovulation. I mean, I of course don't recommend that, because that becomes that also becomes a psychological problem, because then you say now you are trying to find out when you are ovulating. So there are certain tests which can be done nowadays. There are in tests where you can check and find. Otherwise, we do scans and find out when the egg is maturing. So all these things can tell you. But what I tell is now these about 50-60 years also, people conceived. They didn't know anything about it. But what they were just having a very relaxed life, and they were together.
That is the difference.
And they were together, so now, because of all these things, so they have lots of excuses for not being together.
What I just got to know with the facts, by the facts that I have here, doctor, is that there are practical reasons of being infertile as well, like eating disorders and obesity, and even exercising too much. Now that shocked me. So I mean, a person who is really basically motivated to work out a lot, you think that maybe there's sort of a reduction in
not working out a lot, of course, I don't think it is a cause, but obesity is certainly a cause. And one of the causes, common problems you find is this, what is called polycystic ovarian disease. Polycystic ovarian disease is a condition, from birth you have it, but it will manifest in life, later in life. But at what age it manifests, we can't say. So that is why. So you shouldn't delay. So because at the beginning you may not have all these things, but later as you grow older, all these things can manifest. In these polycystic ovaries, you have what are called follicles in the ovary. So in the follicle only you get the egg. So these follicles, from the day of the menses towards the mid-cycle, the follicles enlarge in size. and then when the follicle becomes a certain size, like 18-20 millimeter size follicle, you get a mature egg inside. But when you have these polycystic ovaries, it's not cyst actually, you get lots of follicles, multiple follicles. So these follicles don't enlarge. So when they don't enlarge, the eggs don't mature. So if the egg doesn't mature, the person is unable to conceive. So this is and also when the egg doesn't mature, and the hormone environment in the body is also not in the correct balance. So therefore the periods get delayed. So you can use some don't get periods once a month. They get once in 1-2 months. And then also they put on weight. They get more hair in the body. So all these things are problems of one condition called polycystic. And then later in life they will have problems in the sugar metabolism, like diabetes, tendency for diabetes, the cholesterol and things also can change. So like that. So this is a condition of the ovary which is where there it can manifest in different ways in different ages of the life, and also it can result in infertility.
So this is one common cause of female infertility.
Oh yes, certainly.
What about male infertility?
Male infertility is mainly due to maybe due to the problems in the sperms. So in the sperms you have to have a good count. That means there should be at least 20 million sperms in 1 milliliter, and out of that 50% must be actively motile. So they must be like that. That they must be active. If they are unable to move, then there is no point having even 20 million or 30 million sperms, because it's not functioning, because the sperm has to travel, from the vagina through the womb or the uterus into the tube. So it's a very long distance when you consider the sperm, which is not visible to the naked eye. So this long distance for it to travel, it should have a lot of energy and must be quite normal. So if we have a very small number of sperms, so 20 million sperms means it's like the population in this country. So
it's quite a number to go there.
Right. So
you can. I mean, even if from that number, even if there is something wrong, even the count reduces even a little, then you have infertility problems.
That's right. So if it depends on the amount of reduction, right? So sometimes
you said that this rate is increasing now. Okay. So then that's with so many types of infertility. But now, how would a couple identify that they do have infertility problems? I'm sure that obviously they'll have to visit a consultant and find out, right? So
actually, if they have been trying for a pregnancy for some time, as I said,
because like you said before, if a couple is trying for 1 year or more, they should actually
So not everybody should wait for 1 year, because there will be others. Now, as I said, if they have irregular periods, they get once in 2-3 months, they are quite obese, or they have had some operations in the ovaries, surgery. So or the husband has had mumps, because the mumps is something which can affect the sperm counts, or he has had some operations in the testes, so like that. So if there are certain things which we think will can result in infertility, then they should go and see a doctor much earlier, not wait for 1 year. Also, those who are near 40 years, so if 40 years or above. So
if you are trying to conceive, then it's very important
so not to wait for 1 year. So by the time you wait for 1 year, the periods would have stopped also. So because
that's the reality of it, isn't it?
That's right.
So it's very important. I mean, this is a biological process that's been happening. I mean, obviously, this is how one generation to the next human race than any other species would go on. But it's so important for the one unit, the family, for the family name to continue, or so many other reasons people want to start a family.
For the population to be sustained on my own.
And it's just a basic human need, and I think when it's taken away from us, it's something that really affects people psychologically. So it's very important to have the right information. We have Dr. Hatthotuwa with us, and he has been giving us all the correct information. Don't go anywhere. We'll be right back after another short break, and we'll have more information for you on Good Morning Sri Lanka. Welcome back to Good Morning Sri Lanka, and we are here with the good doctor who has been telling us all about the reasons behind infertility and why this has become such a big problem here in Sri Lanka, and not only in Sri Lanka. I think you mentioned, doctor, especially across the Asian region.
The South Asian region,
this is a problem that is at a very high rate. But we spoke about the symptoms, we spoke about the reasons, but I think when it comes to the medical advances that have come about in the world to treat this, now you are someone who has been in touch with all of these, and you've been providing mother and baby care for so many years in this country. So you are someone who definitely knows all the newest developments that are there when it comes to treating infertility. So doctor, if we can ask you what's on the horizon now?
Yes, actually, if you but we should not go to this newest treatment straight away.
Okay, let's start with the long-standing.
Long-standing treatment, what is needed for everybody is counseling. And they must plan so that they really know how to set about it. So because as I said, this type of treatment may take about 2 years sometimes, not like treating a cough and a cold. So because of that, the proper counseling and planning of the type of treatment should be there, so that you don't get dragged away or stop the treatment halfway and go to another treatment. So ultimately you don't get the proper treatment till the end. So that's the first thing. So you have to have planning and lot of patience and lot of commitment. So all these things have to be there.
And the husband and wife should emotionally support each other.
That's right. There is cooperation. It's a team effort. It's not the wife alone or the husband alone or the doctor from somewhere else, but all have to get together as a team and work together. So then only the success comes. And ultimately you must be prepared to accept anything, because sometimes, because this is not a thing which we can say you will definitely have a baby. We can do to a certain extent, but the final answer given by those above. So therefore we have to be prepared to accept it. So anyhow, that is the basic thing. And ultimately types of treatment, of course, there is what we call induction of ovulation. So when there is difficulty in producing eggs, we can use tablets, or then there are certain injections. The injections are a little bit costly, but that will also help to produce eggs. And then if the sperm count is poor or there is difficulty in being together, then we can do artificial insemination. So using the husband's sperms, where we prepare the husband's sperms, get a sample of the sperms, and then we prepare it in the laboratory. We get the better the sperms, and then we add media to make it more strong, and then you take it into a fine tube and inject it into the wife's womb on the day of ovulation. So like from that we can help a couple whose sperm count is poor or the sperm quality is poor to have a baby. So by doing an IUI, the chance of success in 1 month is only 10%. So that we have to understand, because otherwise
otherwise people think it's a magic formula that will always work.
And expectations are not really
very high. Sometimes people come and say straight away, come and do an IUI. So I mean, if you shouldn't go to jump at an IUI straight away, because the success is, so if there is a specific indication, then of course you should go for it.
Like you were telling us earlier, doctor, is it really important for a couple to focus on one person professionally who is qualified in order to go through the counseling and the consultancy and then towards the latter part of the
I suppose, as I said, it is a long-term procedure. So you should not go from one person to the other, unless that particular doctor or the person who is telling is saying, please go and consult this one now, because he is unable to do certain things. So then, of course, you should do. But so there must be one person guiding you, so that so then you can continue with the treatment without wasting time, and you can be happy that you have done your best. That is all you can do. So ultimately,
there's also something that's, I think we've heard at least, and this is the test tube baby. This is something that has been successful for some couples as well. Maybe you can talk us through what exactly this procedure is.
Yes, actually we are happy that in Sri Lanka now we are doing this test tube baby. Otherwise all this time everyone had to go abroad for this type of.
I see.
But here now.
I think you're one of the pioneers when it comes to that, isn't it, Doctor?
Yeah, no. Anyhow, having this available with us also. So, in the test tube baby is the thing where we can help a couple to have a baby in each step, from ovulation up to fertilization. We do everything, and we do everything in the laboratory. Okay. So we give medicine to produce more eggs, and then we take the eggs out through the vagina under anesthesia, the eggs when they are mature, and then at the same time the husband will give a sperm sample. So we take the sperm and the egg and keep it in a dish, and so that the sperm enters the egg, and it is kept in the incubator. Otherwise, if the sperm quality is very poor and the sperm count is very poor, then we can ourselves take a sperm and inject it into the egg. That is called ICSI, or intracytoplasmic sperm injection. So that is a procedure for people with very, very low sperm counts. Right? So then you keep it in the incubators, and then it fertilizes, and then you allow the baby to grow for 2-3 days, or maybe up to 5 days in the laboratory. Then you take the baby embryo in a small tube and put back into the womb very, very carefully. So,
Amaya, we know that Dr. Hatthotuwa is prominent in his field, and he's one of the pioneers, like you were talking about, in certain procedures when it comes to treatment in Sri Lanka. But what I'm really curious to know is that you must be very experienced with couples who've had certain mishaps when it comes to conception. And personally, what sort of common mishaps or common misunderstandings do couples have when they come for counseling and then for further consultancy?
Yes, actually, as I have been telling earlier, what is most important is to understand and have a proper method or proper plan of treatment, not jump from one treatment to another in a very, very short time.
In your opinion, why does that happen? Why do people jump from one treatment?
Because of impatience, and of or the other people may say, you go and take this treatment, you will conceive the next day.
Right.
So it won't happen, because as I told you, the chances of success is about 20% with normally.
Do you think that happens because of lack of awareness?
Yeah, so to a certain extent.
You have to obviously educate yourself in order to go through this process, right?
Yeah.
Okay.
And then, go on, Doctor.
No. Actually, it is very important, because otherwise, what happens is, at the end, if you are lucky, you will conceive whatever you do. But if you are not so lucky, if we do it in a systematic way, then we are very clear or happy in our mind that we have done our best.
Right.
I think a miscarriage is something again that affects the couple physically as well as psychologically as well. When it comes to situations of that nature, I'm sure it has a relationship with infertility as well. But is that something that's very common, do you find?
Yes, the miscarriage is also a common thing, because 20% of the pregnancies end up with a miscarriage.
20%?
Yeah. So as the age advances, this miscarriage rate also increases. But generally about 20%. So that is something, as what I say is, if you go on the road, there is a chance of meeting with an accident, right? So we can't say you will never meet with an accident and go on the road. So like that. So therefore, if someone becomes pregnant, there is always a chance that 20% of the time it may miscarry. So one miscarriage, one should not worry, because that's maybe just that chance. So the next time when you try, you will conceive and you will end up with a baby. But if it is happening repeatedly, 3-4 times, then of course we have to try. That's right.
But now, Doctor, you've been in this field, you've been working on so many different methods for treatment, for infertility, and helping so many couples, have their own child, and I'm sure that's a very satisfying feeling for you as well. But let's talk about the new developments that you've been working on and others in your field have been working on at the same time.
Yes, so as I mentioned, these artificial reproductive techniques, or ART, with other methods. So as I said, there is this method called ICSI for the males who have very low sperm count. Sometimes a sperm count of 1 million. So
compared to the 20 million.
That's right.
Oh gosh.
So they also can be helped to have a baby. So so then on the other side, if the tubes are blocked, now earlier if the tubes were blocked, they didn't have much of a chance. But with this assisted reproductive techniques, or the test tube babies, they have a chance of conceiving. And then the other thing is, sometimes if we get older women who are more than 40, 45 or so, then they are unable to produce their own eggs. So by this test tube baby programs, we can use a donor. Like for donor sperms, you use a donor egg. And then with that egg you use the husband's sperms and go for in vitro fertilization. So like that, so that type of procedure is also available. So
is there any point during this entire process, now let's say a couple have been going through artificial treatments as well and they've been trying to conceive, but is there any point in this process where you would advise them that, you know, we've done everything we can do, maybe you should look at some other options as well?
Oh yes, certainly. Yes, because there are I mean, there is a limit to what we can do also, and we also must understand when to stop it. Otherwise it is just like horse racing.
That's where the professional treatment comes in.
Yeah, so we should know, because otherwise we would be going on doing it and spending so much of money, and ultimately I mean, we lose on both ends. On one side we may not have a baby, other side we have spent all our money also. So
I think overall it's very important to have awareness and educate oneself, and be maybe under the consultancy of somebody who is professionally qualified, somebody who is academically qualified at least, who has practical experience like Dr. Hatthotuwa, in order to go through this process of conception. Unfortunately, Doctor, time is limiting us today, and we'll have to wrap up this wonderful informative segment that we had. Amaya, what
I learned a lot from this particular segment, and I'm sure that all of you at home as well became just a bit more educated about this issue that's there. And there is always hope if you go to the correct consultancy, and if you go to the correct professionals. And who knows, I mean, this is the birth of a new life, so it's a beautiful experience, isn't it, Anupama? So thank you so much,
Doctor, for being on the show today with us. It was such a privilege to talk to you and learn all these new things.
And with that, I think we're going to wrap up the show.
Yes, for today. We'll be back.
We'll be back tomorrow. Thank you so much for being with us. Take care. Have a great day.
Bye-bye.
Good morning to you once again. Surprise, I had to say goodbye to Amaya and Anupama and take over this segment to give you a little update on the Commonwealth Games, the 20th Commonwealth Games happening in Glasgow in Ireland these days. And of course, to discuss this a little further, I've actually got a guest who is a familiar face to MTV. You obviously would have seen her if you've been watching our news first. Well, Stephanie, hello.
Hello.
A little different to what you've been doing, yeah?
Yes, it is. It is quite different in a more lighter environment.
Great. Yeah. So, okay, so the reason you're here is because you've been giving live updates. Even if people were tuned in last night and watching the news, Stephanie was giving live updates on the 20th Commonwealth Games happening in Ireland right now. Stephanie, for the viewers who don't know much about the Commonwealth Games, could you just give them a little bit of insight as to what it is?
Yeah, sure. Commonwealth Games is usually about people coming together in one place and celebrating sport. So it's 71 countries coming from across the world and coming to one place and celebrating sport in a more sportsmanship way, you know, where people wouldn't really have so much of what do you mean, like, what can I say, so much of anger, or even all they want is to keep that well-being.
And especially the unity among the Commonwealth nations.
Yes, that's right.
And actually they're having 261 events in 17 sports. And for those who don't know, the Commonwealth Games actually started on the 23rd of July. It is a 11-day event, and it's closing on the 3rd of July in Hampton Park. Now, just to give you, we've got a little bit of footage, Stephanie, so let's go straight into that, of what happened the day before yesterday, and we'll discuss it after we come back. Have a look at this.
Service over, 9-17.
Trying to get the serves exactly right, but that's causing a few mistakes.
Service over, 18-9.
So we are 3 points away from Ratnasiri of Sri Lanka winning this first round match.
Service over, 10-18.
Lovely smash from Rashid.
11-18.
She does look rather defeated though in her manner.
Service
Good
over,
judgment from
19-11.
Ratnasiri to get to 19-11, 2 points away.
Service over, 12-19.
Good shot.
Service
And
over,
we are at
20,
match point.
Match point, 12.
Oh, and that was all too easy at the end for Ratnasiri. Right at the net. Shot her right above her, tapping it in for a straight games victory. 21-11,
Match won
21-12.
by Achini Ratnasiri, 21-11, 21-12.
That match was under 20 minutes long. Ratnasiri of Sri Lanka advancing to...
Well, what you saw right there was a match between Sri Lanka and Maldives. The lady, with the left-handed lady with the yellow jersey was actually the one representing Sri Lanka. Now, I was just talking to Stephanie while we were playing the video clip, and Stephanie is actually, she's not a badminton player, but she is a tennis player. But Stephanie, if you could take us through what we just saw.
Yeah, what you just saw was the qualifying rounds of 32 in the badminton event in Glasgow 2014, and Achini Ratnasiri being a left-hander, she used a lot of tactics, and later on she was defeated by a New Zealand national called Michelle Chan, just 2-1, and she used some amazing tactics across the court, but she just fell short a few points because she couldn't keep the stamina constantly, like as opposed to her opponent. Her opponent kept the stamina very well, quite stable actually, and she wasn't deteriorating in comparison to her opponent. So we were all watching with our fingers crossed, hoping that Achini would get through today's round, but unfortunately maybe she was not lucky enough to get into the second quarterfinal round.
So just take, I mean, there was lots of activity with Sri Lanka happening in the games last evening as well.
A lot of activity.
If you could tell us what went on
sure. Well, if I walk you through all what happened on day 7 of Commonwealth Games, Lakmali, she's one of our favorites, one of Sri Lanka's favorites, and she was javelin through, and she'll be heading into the quarterfinals, in which results will be out soon. MTV Sports, of course, has been giving you live feeds. So
and
I'm
by
sure
MTV Sports, that means Stephanie as well.
Yes, that's true, that's right. And well, she's one of our hopefuls, amazing athlete, and she'll be heading into the quarterfinal rounds, and her best so far is 60 meters, so we are hoping that she would be surpassing her lifetime best. So and another favorite of ours is we have a boxer actually, Shiramali Veeratna, whom we never thought would perform that well, but yesterday she just proved us all wrong by defeating Lesotho national by just under 49 seconds.
Wow.
All we could see is just her punching her way through to the next round, and we were all shocked when we found out that she is actually going into the quarterfinals of Glasgow 2014. So she'll be going head to head against a Nigerian today. So results will be out later on in the day, which I am not very sure of yet. So I'm sure the feed is still going on. So we'll only find out later whether she will be qualified to the next round of the game.
That's great. Well, of course, we at MTV Sports and Stephanie has also been working very hard at it. We've been giving you live updates on the 20th Commonwealth Games happening in Glasgow. And of course, we'll be doing it all the way till the 3rd of August, won't we, Stephanie?
That's right. That's right.
And
3rd
if
of August.
especially if today being Thursday, what time can people actually tune in to check out some updates?
Well, the live feed goes on from about 12 p.m., but we will be giving expert analysis starting from 11:30 onwards. So viewers can tune in to MTV Sports just to be on the know, to be updated throughout from 12 o'clock. So it's a big event. 71 nations coming to one place. It's a huge event where Sri Lanka has already been winning a silver medal for the country. So it's a big thing for Sri Lanka. So we just have to keep our fingers crossed and keep cheering our players there.
Well, there you go. Thank you very much, Stephanie, for that update and being with us this morning. I'm sure you have a busy schedule at MTV today.
Yes, I do.
Well, that's it from us for this morning's show. That's a little update for you on the 20th Commonwealth Games happening in Glasgow. Of course, you can tune in to MTV Sports periodically all the way till the 3rd of August to check out what is happening with the event. Now, just before we leave you, we're going to, of course, play you some music. And this one's by Enrique. Enjoy and have a great day.